Root canals are a common dental procedure that is often necessary to save a severely infected tooth. However, many people may wonder what would happen if they choose not to get a root canal. In this video, we will explore the potential consequences of not getting a root canal and why it is important to seek treatment if recommended by your dentist. First and foremost, it is important to understand why root canals are recommended in the first place. When a tooth becomes severely infected or decayed, the inner pulp of the tooth can become inflamed and infected, causing severe pain and potentially leading to an abscess. A root canal is a procedure in which the infected pulp is removed, the inside of the tooth is cleaned and sealed, and a crown is placed on top to restore the tooth's functionality. If you choose not to get a root canal when it is recommended by your dentist, the infection in the tooth will continue to spread and worsen. This can lead to a variety of serious consequences, including 1. Severe pain. The most immediate consequence of not getting a root canal is ongoing and potentially worsening pain in the affected tooth. The infection in the tooth can cause intense, throbbing pain that may be difficult to manage with over-the-counter pain medications. 2. Abscess. An abscess is a pocket of pus that forms at the tip of the tooth's root when an infection is left untreated. Abscesses are serious dental emergencies that can cause swelling, fever, and extreme pain. In some cases, an untreated abscess can lead to a life-threatening infection that spreads to other parts of the body. 3. Tooth loss. If the infection in the tooth is left untreated, it can eventually destroy the tooth structure to the point where it cannot be saved. In such cases, the tooth will need to be extracted, leading to the need for costly and time-consuming tooth replacement options such as dental implants or bridges. 4. Spread of infection. Infections in the teeth can spread to other parts of the body if left untreated. Bacteria from the infected tooth can enter the bloodstream and potentially lead to serious systemic infections, including infective endocarditis, a life-threatening infection of the heart's inner lining. 5. Chronic health problems. Chronic dental infections have been linked to various chronic health conditions, including heart disease, diabetes, and respiratory infections. By not addressing the infection in the tooth through a root canal, you may be putting your overall health at risk. Ultimately, the decision whether or not to get a root canal is a personal one that should be made in consultation with your dentist. While it is understandable that some people may have concerns about the procedure, it is important to remember that root canals are a safe and effective way to save a severely infected tooth and prevent serious consequences down the line. If you are unsure about whether or not you need a root canal, it is important to schedule an appointment with your dentist as soon as possible. Your dentist will be able to evaluate the condition of your tooth and recommend the appropriate treatment to ensure the health and longevity of your smile. In conclusion, if you are recommended to get a root canal by your dentist, it is important not to ignore their advice. By getting a root canal when it is needed, you can save your tooth, alleviate pain, and prevent serious consequences such as abscesses, tooth loss, and systemic infections. Don't wait until it's too late. Seek treatment for your dental issues as soon as possible to protect your oral and overall health.